The next observational study designs are the analytical types. First, we have prospective cohort design. This type of design, the investigator chooses or defines a sample of patients and determines the presence or absence of characteristics. In example, exposure or risk factors or protective factors that might predict the outcome. It looks forward in time to assess for occurrence of outcomes. It can be summarized in this chart. Cohort studies measurement is the relative risk, or RR. It is used to measure the effect the exposure had on the outcome. The ratio of probability of an outcome occurring in the exposed group versus the probability of an outcome occurring in an exposed group. If RR or relative risk is greater than 1, it, it implies increased risk. If RR is less than 1, it implies decreased risk. And if RR is equals to 1, there's no difference in risk between exposed and unexposed group. Example for results with RR 0.25, it is interpreted as 75% decrease in relative risk. If RR is 0.80, it means 20% relative risk reduction, while if RR is 1.5, there is 50% relative risk increase or 1.5 increased risk. If RR is 2, there will be 100% increased risk or twice increased risk. Prospective cohorts advantages and disadvantages. The advantages are it identifies incidence of a disease, good for studying rare exposures, can, can assess multiple exposures and outcomes. The variables measured completely and accurately, such as exposures, confounders, and outcomes, and its temporality is demonstrated. While the disadvantage, it cannot identify cause and effect. It cannot control for confounding variables. It is expensive and inefficient for study rare outcomes. Also possibility of selection bias and loss to follow-up. The next type of cohort is retrospective cohort design. The investigator chooses or defines a sample of patients and determines the presence or absence of characteristics that might predict the outcome. It looks back in time to assess for occurrence of outcomes. Only possible if adequate data about exposures and outcomes has already been collected, such as medical records, insurance claims records, and other documentations. Here is the summary of retrospective cohort design. Retrospective cohort design has also the same measurement with prospective cohort design, which is relative risk. Now let's move forward to the advantages and disadvantages of retrospective cohort. The advantages are it can identify incidence of a disease. It's good for studying rare exposures, and it can assess multiple exposures and outcomes. Also, exposures and risk factors that might predict an outcome are already measured. It is less costly and time-consuming than prospective cohort, and no loss to follow up. Also, temporality is demonstrated. Disadvantages are cannot identify cause and effect, cannot control for confounding variables. It is expensive and inefficient for studying rare outcomes. Investigator has limited control over sample design and predictor variables. It can recall bias and it can have incomplete or inaccurate mismeasured variables. The next analytical observational research study design is the case control design. Cases and controls are random samples from same source population. Individuals are identified based on outcome of interest. The one with the disease are called cases and the one without the disease are the controls. Risk factors from the past are measured using case control and it can attempt to identify etiology or cause of disease. Usually, case control design is retrospective. Here is a summary chart of case control design. Case control study design measurement is odds ratio or OR. OR is about the odds of getting a disease after an exposure divided by the odds of getting the disease without the exposure. Odds ratio approximates the relative risk for rare outcomes and is interpreted the same way as relative risk. Odds ratio more than 1, it has increased odds. Odds ratio less than 1, there will be decreased odds. And if odds ratio is equals 1, there's no difference in odds with the exposed patient and the unexposed patient. Now, for the advantages of case control, it is efficient when the outcome disease is rare and interval between exposure and outcome is long. Multiple exposures can be studied and the control for multiple confiners is available. Shorter observation period than prospective cohort and it is inexpensive and no loss to follow up. The disadvantages are it cannot estimate incidence or prevalence, it is predetermined study groups, only one outcome can be studied, important info may be missing, and incomplete, inaccurate, mismeasured variables is possible, and bias is also expected. This is the summary comparison of cohort retrospective and cohort prospective with case control. The question will differ what happened versus what will happen and why it happened. It depends now. You have to choose the correct research design on what type of question do you want to answer. The next one is cross-sectional design. The individuals of interest are identified and all variables or the exposure and outcomes are measured at one cross-section of time or the snapshot. It is useful for measuring of the burden of disease and what is happening currently. The advantages of cross-sectional design, it has good estimation of prevalence, it can assess multiple outcomes, it is simple, inexpensive, and no loss to follow up. But the disadvantages are it cannot identify cause and effect, it has no temporality determined, and it rarely advises treatment decisions. The next type of observational study is a descriptive type, which are case reports and case series. Descriptive type of observational research design also includes surveys and qualitative research designs. Case report and case series, these are descriptive reports regarding a possible association between exposure and outcome. It has no comparator group, often presented within or with a review of the literature, and have a role in discovery of diseases and undocumented effects of medication. The strengths of case reports and case series is first, it identify new disease or adverse effect not documented before, and it is valuable in providing insight to other clinicians who may see similar or unusual scenarios. But the weaknesses are it cannot identify cause and effect. There's no control groups and small number of patients. It provides no info on frequency, and it is the weakest literature among all observational studies. In summary, observational study designs are cohort research design, case control, cross-sectional surveys, and case report and case series. According to timeline, we have prospective cohort, retrospective cohort, and case control, and cross-sectional. It can be summarized this way: comparing past with the present and the future.